from that, but it's better than nothing. But then it's just a matter of time then before you eclipse even your capacity as you've ramped it up with all these other devices. And those individuals are not going to have ventilators, and they're going to need them. I mean, it is that simple. I mean, that's why I've been telling people for weeks now, there is no reason to think that Louisiana won't look like Italy. And I know that's a hard, bitter pill to swallow, because that picture is rather gruesome. It's not what we're accustomed to. We don't ever want to see that. In fact, I think I saw where Dr. Fauci said today that the entire United States of America is on track to kind of look like Italy as it relates to the spread of this disease. And I don't know if he was specifically referring that to the ability to deliver medical care, but the overall modeling and the growth of cases and so forth across the country is looking like that. And so everybody should understand that this is not going to be a pretty picture, but we are still in control of just how bad it gets. But even under the most feasible best case scenarios, we do eclipse our capacity for ventilators, but it's by a much smaller number. Yes, sir.
Actually, I have a question for Dr. BU that's actually about testing. In Caddo Parish, there's one community testing site. They've done 8,500 commercial tests. The next highest parish is Orleans, which was ground zero for this and has 10 times as many positive cases. Can you explain why Caddo Parish is blowing every other parish out of the water for commercial testing at the rate that they're doing?
So, I mean, when you get to commercial testing, it's a really complex answer. We know we don't have visibility, for instance, at the state level in outstanding tests. What we see is when tests are reported back in. Some of the large facilities, certainly the FEMA sites, we know how many tests are being generated there, but we wouldn't know how many one of the testing sites, say in Region 4 in the Lafayette area, is doing comparatively. What I can say, though, is it's tough to get access to the specimen kits, and we're seeing that is a limitation for some of our communities. We obviously focus our specimen collection kits on hospitals. That's where we want to make sure if you need a test in a hospital, you have access to it. But we certainly want to see expanded testing in lots of regions, similar to what you're describing would be happening in Caddo.
Are you guys researching that, trying to figure out why it's been so successful in Caddo?
And more broadly, as I noted, I think maybe a couple of days ago, we know that there are new machines coming online that not only can return results faster, but that can do more tests at a time. We're looking at those. The state lab is also not only expanding with tests or expanding with machines that we purchased a couple of weeks ago, but even yesterday I was looking at acquiring even more throughput through new machines. We would like to be in a position where we can test much more broadly. However, I think the other really important message is that needs to get out there rather is even if you do not have access to large amounts of testing in those areas where we're not yet getting the testing where we want to be, if people are feeling ill, they should be staying at home and they should be talking to their providers. If you have the symptoms consistent with this and you can't get access to a test, that's not a reason that you shouldn't be isolating and taking all those other precautionary measures.
In fact, I would tell you that with a stay-home order, you ought not require a symptom before you stay home unless you are an essential worker or you absolutely have to go out. But everybody who feels sick with a fever, with a cough, with shortness of breath, you absolutely need to be staying home, period. Yes, sir.
Governor, the White House yesterday projected that even with social distancing measures, 100,000 to 240,000 people will die. You mentioned that projection. What is our projection in Louisiana for how many people might die given the current social distancing measures in place? And when is our peak currently forecasted for? We've seen various projections in the middle of April. I know you said it's a critical 30 days right now.
Yeah, I don't have that number. I don't know whether you do, but I would tell you that if you just look at the numbers that came from the federal government yesterday, from the president's press conference, and understand that we have the third highest per capita number of cases right now. If you look at the trajectory that we're on in terms of case growth, and we showed that to you just a while ago, and if you consider that already we are number 2 in the country in per capita deaths, as a state, with 5 or 6 of our parishes among the top 15 or so in the entire country. You know that this is not a pretty picture for the state of Louisiana if we don't practice much better social distancing and mitigation to slow the spread. And so the messaging coming out of the White House yesterday is exactly what we've been trying to communicate to the people of Louisiana for some time now. And there is no really pretty picture. There's not a pretty picture for the country. There's not a pretty picture for the state. But it doesn't have to be as ugly as the model suggests it would be if we didn't do mitigation. And it is entirely within the power, the control of the people of Louisiana acting individually and collectively to determine just how bad it gets, even though it's going to be a tough situation regardless. Leo?
Once we get past the health issues, which obviously are paramount, the economic tsunami that's headed toward the country is paramount too. They talked about that considerably this morning out at the White House and on CNBC especially, but they're saying that the CEOs of the top 7 energy companies in the country, ExxonMobil and Chevron, are headed to have a summit with the president Friday, which is unusual. Louisiana is one of the top 4 oil-producing states in the country. Have you been in touch with any of the smaller Louisiana energy companies that may be looking for help or see something on the horizon where there could be layoffs?
Well, obviously, this is a tremendously tough environment for energy companies, and that is for a couple of reasons. One is the coronavirus situation that would depress demand, not just in the United States, but around the world for oil. But secondly, because of the spat that Saudi Arabia and Russia started just before the coronavirus situation blew up, when they're vying for market share, regardless of what that does to price, which is 180 degrees different than the way Saudi Arabia had always conducted itself before that. So this is a very, very challenging environment around the world for oil and gas companies. That is obviously the case here in Louisiana. I have had communications with the Louisiana Oil and Gas Association and the Louisiana Mid-Continent Oil and Gas Association. We've done conference calls. We have other business calls that I'm not necessarily on. And we're trying to do what we can to help. But quite frankly, this is a very distressing situation for them and as a result for our state. And I don't obviously have any inside information about what those 7 CEOs are going to be relating to the president or potentially asking him for. I do know that in phase 3, the bill passed by Congress last week that was signed by the president, there were no provisions, as I understand it, for the oil and gas businesses, like there were, for example, for airlines and so forth.
They're specifically saying that they're not asking for a bailout.
Yeah. Yeah. Well, and there were not any there, but I don't know what they're going to be asking for. Was my point. I know what wasn't in phase 3, the legislation that Congress passed. I don't know what they're going to be asking for, but obviously we remain committed here in Louisiana to meeting with them and seeing what we can do to potentially help them as well.
Prices dropped from $60 a barrel down to $20. West Texas Intermediate today.
Yeah.
$40. I mean, that's almost a 70% drop.
Correct. And that's tough. The only bit of good news there, I guess, is how little consumers are having to pay at the pump. But that's very, very bittersweet, because we would much rather see the price of gas back where it should be in relative to the barrel of oil, being up around $60 or so. Yes, sir, we're going to come back to Melinda.
Governor, have you gotten any additional guidance from the federal government about the $1.8 billion that the state is supposed to be getting from Congress, and when that will be received and what it can be used for? Like, can it be used as the state's 25% match with FEMA, for example? Okay,
I'm going to share with you what I know. It's not a lot. On the call with the National Governors Association this morning, we discussed this, and yesterday individuals from the U.S. Treasury's Department met with staffers from the National Governors Association and others. and indicated that we will be getting guidance on how these funds can be spent and how they cannot be spent sometime right after Easter. The funds themselves should be made available on or about April the 24th, which is almost the 30-day period because the law requires the funds to be made available within 30 days. Now, we are being told that you cannot use the funds to make up for revenue that has been lost, but you can use it for expenditures that have been incurred because of the coronavirus and COVID-19. And that there will be tremendous flexibility in the guidance that comes from Treasury on or about April the 24th as it relates to expenditures that are covered. You know, for example, one of the things that I'm interested in knowing, and just as a reminder, the amount coming to the state of Louisiana is going to be right at $1.8 billion. I am interested in knowing whether that funding, if it's going to be flexible, can be used to pay our state share of the 25% cost match that we have to put up for a FEMA-approved expenditure. Because typically you can't use federal sources of funding for a non-federal match. But in this particular case, I believe we will be able to do that, but that is not yet clear, and we are asking for clarification on that. But we should know a lot more right after Easter in about 2 weeks, and then we should get the funding on or about April the 24th. Yes, sir.
Why are you more, and maybe Dr. B, why are you more apt to die in Louisiana than elsewhere? Is it because of subpar care, because you're more prone to underlying conditions? Why is that?
Well, we've been reporting for decades, generations, that we have more chronic health conditions per capita in Louisiana than most states. And when you factor that with the number of cases per capita and the growth that we've been showing you, and that those underlying health conditions are the very ones that make you most susceptible, most vulnerable to this virus, what you see playing out is something that's very tragic. And you know, obviously we wish it weren't so, but we have individuals who are dying in greater numbers because they have diabetes in greater numbers, because they have kidney disease in greater numbers, because of the obesity. Those are the three chronic conditions that account for most of that. But there are others. Could be respiratory disease or condition and heart disease, for example. And I'll ask Dr. Bu if he wants to come and amplify that message or correct it, but he and I had this conversation just before we came in, and that's what he told me. It is not because of substandard care. I will tell you, our hospitals, our medical professionals are doing a tremendous job, and it is not because of substandard care. But I'm asking people in Louisiana to understand that their fellow Louisianans, because of the reasons that I just mentioned, are more vulnerable than other people. And so we have a greater duty, it seems to me, to be good neighbors and to practice the social distancing and to comply with the stay-at-home order. Yes, sir.
You did mention very briefly that you're starting to see some numbers flatten, I believe, in the New Orleans area. Can you be very specific about which numbers are starting to flatten and what data is driving that surge?
So any one day's numbers can be an anomaly and don't necessarily indicate a trend. And we are looking at modeling coming from different places, not just ours, and try to see whether there is a confluence, if you will, of these models. And it just appears that with the rate of growth of new cases in that region, in Region 1 around Orleans and Jefferson Parish, that we are starting to see a slight tapering off. I hesitate to say that for a couple of reasons, one of which is tomorrow's data could upend that altogether. Secondly, some people will hear that and think, oh, well, our job is done. Well, that is just, completely erroneous. Nothing could be further from the truth. We have a long way to go. This is going to get much worse before it gets better, and nobody should think that we're out of the woods. We can't even see the light at the end of the tunnel yet.
Last one, Sam.
Yes, sir.
Yeah, Governor, the stay-at-home order is now in place until April 30th, but
Well, it's not technically, but it will be.
it will be.
Yeah, but before the end of the week, we're going to extend this order through April the 30th, and we're going to extend all of the current proclamations to that same time period and get them all. They'll all be wrapped up. So this next proclamation you see is going to be a long one because we're going to take all those measures, put them in the proclamation again, and extend them to April 30th. But go ahead.
Before that, I know you indicated that this was more like 4 weeks after the April 13th, which would take us well into May, but how long should people be prepared in their minds to have social distancing measures and restrictions in place by the state, even though the date right now for this week will only be April 30th?
Yeah, well, the intensity of the mitigation measures and how long they continue will be a result of the facts on the ground. I think that people should start trying to prepare themselves in their minds that it's going to be a long time before we're back to normal. Even after the most restrictive measures are lifted, we don't know yet whether there's a seasonality to this virus. We hope and pray that there will be some diminution in the virus in terms of its spread and the cases across the summer. There's some reason to think that may happen, but there are other reasons to think it won't because it's been spreading south of the equator where it's been warm. So we don't know. I will remind you that this virus could come back this fall. And when I say come back, that assumes that it never leaves. But it could come back this fall. That's exactly what happened with the Spanish flu situation in 1918. There was a spring outbreak, and people thought it was over. It came back, the exact same strain of the flu, and killed many millions more in the fall. And so that could happen. It all depends on when the first really effective and proven therapeutic treatment comes online. It depends on when we actually have a vaccine that is approved before things can get back to normal. And then I suspect there's going to be an effort at some point, and the testing has to be developed and approved by the FDA, to measure whether people have developed the antibodies or immunity to it. And if so, those individuals will be able to resume something that looks like a normal life sooner than others, people that haven't yet caught it, while we're still looking for therapeutic treatments and vaccinations. I'm certainly not an expert on this, but there is the concept of herd immunity, and at some point, if it stays with us long enough, you may not actually have to contract the disease in order to develop some limited immunity to it, but this is all going to play out over many months and so forth. But what I'm trying to say is people should go ahead and start coming to terms that things are going to be a long time getting back to normal. And you can look at what's happened in other countries where they released, they removed some of the restrictions, and they immediately saw a spike in the cases and had to put them back in place too. And so that could happen here. And so I know that this is not the news that perhaps you wanted to hear, but that's the best information that we have right now, and I think it's consistent with what people like Dr. Tony Fauci and others are saying. But I don't want people to be so focused on and worried about what happens 12 months from now or 18 months from now that they forget what the task at hand is right now, and that is slowing the spread. And you can do that. Everybody out there can do that. You just have to make sure that you're staying at home, that you minimize social contact, that you follow all the hygiene measures that we've been talking about and others have been talking about for so long. And if we do that, we're going to slow the spread to the maximum degree that it can be slowed. Then we will have fewer patients presenting to the hospital at any given time, and we will be able to take care of more of those who do present. That's just the way this has got to work. And we should all be preparing ourselves for a period of time that is not going to be pleasant, but understand that we are largely in control of just how unpleasant it will be. And I know that we can count on the people of Louisiana to do what's asked of them because we know how to be good neighbors, and we're good, decent and generous people, and we know how to take care of one another. And right now, we take care of one another by staying away. It really is just that simple. I'm sure I'll be seeing you all sooner rather than later. Thank you all so much.